Assalamu alaikum, my dear friends. My name is Dr. Imran Hamzawala. I'm an honorary consultant gynecologist and a Gynaec-Oncological consultant at Saifee Hospital. I'm also the chief of the Robotic Surgery program or the Robotic Surgery department at Saifee Hospital. Let me just talk about my journey through medicine at the first instance, just so that you can get to know me a little bit better. I did my MBBS from Grant Medical College, so J.J Group of Hospitals, and then I moved to the UK to acquire my postgraduate training. Through my training, which was for many years in the UK, I stayed in the UK for over a period of 14 years, and during this time I acquired immense amount of experience in the field of gynecology and gynecological oncology. I was fortunate to work in the Centre of Excellence at Royal Surrey County Hospital, which is a place in Guildford in Surrey in England, and this place is the Centre of Excellence for robotic surgical techniques and gynecological practice. So I consider myself very fortunate to have had the opportunity to work there. Following finishing my training, I became a consultant in one of the university hospitals in London. And I moved back to India, which is back to the city that I was born in, which is Mumbai, about 4.5 years ago. And ever since then, I've been a part of Saifee Hospital, which is based in Mumbai. So friends, today I would just like to discuss with you about a surgical technology, or rather a surgical tool, which is robotically assisted surgery. And I would like to shed some light on it, because a lot of the times people don't know exactly what it is, and I hope that at the end of my talk it will become apparent that this is just another surgical tool that is used in clinical practice. So let's start from the very beginning. Let's start with surgery. From the beginning of time, human beings have been involved in medical practices, in surgical practices, and when surgical practice first started, it was always open surgery. What do we mean by open surgery? Is where we put a cut on the patient's body part. So if it's the arm, then it's on the arm. If it's the tummy or the abdomen, it's on the abdomen. So it's a big cut to get access for the surgeon to do what he needs to do. So the focus at the time in the past was, with open surgery, what doctors wanted to achieve was to take the problem out and save the patient's life. So you can imagine that in the good old days, when surgeons were the ones who actually took the problems out and saved the patient's life, how immensely satisfying that profession would have been. So many years went by where these surgical practices carried on. And then it sort of transpired saying that, look, hang on, we've saved the patient's life, but have we made that patient's life worth living? When I say worth living, I mean, is his or her quality of life as good as it was before? That's the question that people started asking. So when I say quality of life, what exactly does it mean? That after having had surgery, you have patients, can he go jogging again? Can he have his normal sexual life? Can he do the jobs that he wanted to do? Or can she cook at home? All the normal things that human beings enjoy in their daily lives after going through a major operation, did that all come back to what it was? And that was the question that needed answering. And that brought about the dawn of laparoscopy. Laparoscopy, by definition, is keyhole surgery, where you put small cuts in on the organ around the organ that you want to operate on, and you get instruments in to allow it to do the work that you want to do. So that brought about the birth of minimally invasive surgery. Minimally invasive surgery changed the game because patients started going home quicker. There was lesser blood loss. All these benefits improved surgical morbidity. What that means is that patients were able to get back to their lives more quickly, as quickly as possible. We are in 2020, and it's crazy to even think that laparoscopy is not talked about. In my clinical practice, being a gynecologist and a gynaec-oncologist, I have so many patients who come to me and say, "Doctor, can this surgery be done laparoscopically or via the minimally invasive route?" So patients are asking for it because they know that there are benefits to doing it. So human beings are fascinating because we as human beings, we want to constantly improve. We want to change the way we practice medicine. We want to change the way we practice surgery. What for? For the benefit of the patients. So in that endeavor of trying to push the envelope and trying to do things better, that brought about the idea of robotic surgery. So right now, dear friends, I used the word robotic surgery. Sometimes that gives the impression that, hang on, I think it's the robot that does the surgery. So what's the need for the surgeon? I've had patients ask me that question, saying that, doctor, if the robot is going to do the surgery, what are you going to do? So I want to make this very, very clear that I prefer calling it robotically assisted surgery. What that means is the robot is not autonomous, and the robotic instruments are 100% in control of the surgeon at all times. For the benefit of your understanding about what the instruments of robotic surgery are, along with this talk, we've added some pictures to try and explain things to you. That the robotic surgical equipment involves three parts. One is a patient cart, which attaches to the patient. One is a vision cart for the benefit of the team in the operating theaters, that they can see what's going on at the time of the surgery. And the third bit is the surgeon's console, where the surgeon actually sits down and uses the master controllers to operate on patients. So whatever movement he does on the master controllers are replicated at the patient side. So why is this beneficial? What's so great about robotic surgery? So let's talk about that, ladies and gentlemen. The most important bit is that the robot provides you with a full high definition, 3-dimensional, 10 times magnified view that is offered to the surgeon to perform the surgical techniques. So what I'm trying to say is that with the benefit of this technology and the vision, and even the tip of the instruments, which are wristed, which means the instruments that go inside the patient's body cavities have got wrists on them, which means they can move like this, like the human hand. So having all of this technology at the disposal of the surgeon allows the surgeon to go in areas which was perhaps once deemed quite difficult to get into, and now we are able to get into those areas and perform really complex surgeries extremely well. What is the goal of surgery? The goal of surgery per se is to take the problem out with causing least possible collateral damage. And that is the aim of surgery. And we are in 2020 blessed with a technology that allows us to push the envelope and get closer to perfection. And that's the beauty of robotic surgery, and that's what I'm here to discuss with you about. It's not surprising that in the United States alone, you have more than 2,500 operational robots. India is now quickly picked up, and we have more than 70 to 80 robots as we speak, operational across the country. One of those robots, I'm very pleased to say, is at Saifee Hospital in Mumbai, which we use as a team. So it is my strongest possible belief that robotic surgery is just one more step in the evolution of surgical practice. What it allows us with this extra vision, with this high definition image, is that there is less bleeding at the time of surgery. We use less gas than conventional laparoscopy at the time of surgery. There is less pain post-operatively, which is demonstrated by the patient. And the chances of needing to convert from minimally invasive to open surgery are statistically shown to be less in robotic surgery. So what that means is that this is the next step in the evolution of surgical practice. It is my earnest belief that if you combine modern technology with good clinical skills, and let's not forget, very important is team, a good team, then all of these three things will translate to good patient outcomes. I insist on the team because it's not the surgeon that gets the credit for the entire operation. It's the whole team, the nursing staff, the technicians, the helpers all around. All of these people are essential, the post-operative care that the patient gets on the ward. We need this team to have success in an operation. And the beauty of that, the availability of that team at Saifee Hospital is there, it's well trained, and we provide an excellent service. Let's move on to where technology is taking us. Most importantly, we have to understand that technology is moving on. Now, you may appreciate that to get the instruments in, we have to give very small cuts on the patient's body to allow the instruments to go in. At this present time, we have maybe two or three cuts to allow the instruments and the camera to go in. But the human mind is not satisfied with that either. Look at where we've achieved. Right now, FDA approved, we have something known as single port robotic surgery, which means in the United States, they've already tried and tested single port robotic surgery. What that means is to do the entire surgery with one single incision. So what I'm trying to get to, ladies and gentlemen, is that the human mind or the medical teams continue to push the envelope for the betterment of mankind. And this is just one step in that direction. Friends, I'd like to just perhaps suggest an analogy of explaining what robotic surgery or advanced technology is all about. Remember the days when we had paper maps, when we were driving a car and we had paper maps. So what we did, we looked at the paper map and he said, I have to go from A to B. So, okay, I need to go on this road. You looked at road signs and then you drove your car. Somewhere around your drive, you felt, am I right on the right path? You park on the side of the road, you check your map again, and then you make sure that you're on the right path. And then you would eventually, there is no doubt that you would get from A to B. But when technology started coming in, think about it right now, dear friends, that you're sitting in cars which has a GPS satellite navigation system. And if your car doesn't have a GPS satellite navigation system, your mobile phones has Google Maps. We use that all the time to travel from A to B. Doesn't that experience change the way you drive? When you drive, are you not more comfortable, not worried about whether I'll reach my destination or not? So what has this modern technology done? It's taken away the stress that the person has whilst driving and allows him to efficiently get from point A to point B with least possible stress. What I'm trying to get to is that modern technology is allowing the surgeons to do the job efficiently, quickly, with the least possible stress. And that is to the patient's benefit. When I was working in the UK for so many years, and I had over 7 years worth of exposure of robotic surgery in the UK itself, it was apparent that UK was very strict on guidelines and protocols. Everything needed to be there. So what do you mean by guidelines and protocols? Is that if these particular guidances or protocols are in place, then the chances of errors at the time of surgery are minimized. So let me give you an example. So in robotic surgery, we would like a robotically assisted nurse who is well trained. We also want an anesthetist who knows how to anesthetize robotic patients. We also need a technician present at the time of surgery to make sure that the instruments are all working and are in order. So we've adopted all those guidelines and protocols and used that in our clinical practice at Saifee Hospital. I'm delighted to inform you, ladies and gentlemen, that we have done close to 600 surgeries in this time in our robotic surgical journey. The best part about working here at Saifee Hospital is that me being a gynecologist, of course, we do a lot of gynecological operations, but we do robotic surgeries for a lot of other indications. And allow me to discuss that with you. Robotic surgery is always spearheaded predominantly by the urologists, because if an individual has got prostate cancer and needs surgery, in today's date, the gold standard for operating on prostate cancer surgeries is robotically assisted radical prostatectomy. What that means is that if you were to do it by any other way, you are providing the patient a disservice. So because it is the gold standard, radical prostatectomies are now almost everywhere being done robotically. So urologists lead the way, followed by the gynecologists, like myself. So in gynecological practice, I can give you some examples. We have lots of patients with endometrial cancers, which is cancer of the lining of the womb or the uterus. And these patients predominantly tend to be obese, larger women. And they tend to have those sort of problems. So robotic surgery really stands an edge in those sort of scenarios. We also do complex endometriosis surgeries, myomectomies, which is removal of fibroids, vesicovaginal fistulas, all kinds of complex gynecological operations. In Saifee Hospital, I'm delighted to say that we are multi-specialty, which means we do surgeries of different specialties. We do transoral robotic surgery for removal of tumors from the base of the tongue and the tonsillar tumors. We do radical neck dissections. We do esophageal cancer surgeries, which is food pipe surgeries. We've done lung lobe resections, mediastinal node resections, pancreas surgery, liver surgeries, bowel surgeries, urological surgeries, partial nephrectomies, which is removal of only the tumor from the kidney and saving the normal kidney tumor. These are the sort of groundbreaking surgeries which are being done at Saifee Hospital, and we've achieved a tremendous success in the same. All in a nutshell, what we like to do is that we like to collaborate with other units across India, and we also collaborate with units in the UK and overseas abroad to learn new techniques perhaps, and to get more insight into how we can keep improving ourselves in the best interest of our patients. Now, all I would like to say is that by doing all of this, we create a very safe surgical environment. Safe surgical environment works to the patient's benefit because we improve patient outcomes, and it's also equally good for the surgeon, because if you create an environment which is safe and comfortable and easy for the surgeon to practice, it also improves his or her efficiency and thereby translate into better outcomes. I hope in this small talk of mine I've been able to explain a touch on what robotic surgery is all about and what it has to offer. And I would be very happy to answer any of your questions, be it by email or over the telephone if you had any. And I will share my details with all of you. Thank you so much for having me, and I wish you all the best. Please stay safe in these difficult times, and all the best. Masalam.